56 million Americans suffer from hair loss. 40% of those are women. Dr. Scott Thompson is joining us now from Utah Facial Plastics. This is a good person to ask this question to. Is it genetic? What is causing the hair loss?
Hair loss is genetic, so some people have hair loss in their family, and you see that from generation to generation. But the root cause of hair loss is there's decreased circulation to the hair follicle, and when this happens, the follicle gets smaller, it shrinks down. We call it miniaturization, and eventually it just dies, and then there's no more hair there.
There's a new technique out there called PRP Hair Restoration Therapy. What is that?
PRP stands for platelet-rich plasma. So this plasma is your own blood. We draw blood up in a tube and we spin it down and we pull off the platelets. Platelets are very important to the healing process, and so when we inject platelets into the skin where the hair is, they have all of their growth factors and all of the nutrients that help to decrease or to increase circulation to the follicle and increase new blood vessels.
So that actually stimulates the hair growth?
That stimulates blood flow, which in turn stimulates hair growth. Exactly.
Who is this for? Who's an ideal candidate?
Really, anybody's a candidate. There are lots of other therapies as well, and so what we typically do, we'll sit down and say, these are our options, and this is a new one, this is why we're talking about it, but there are other options as well, and we kind of just sit down and kind of figure out whether it's a surgical or a non-surgical option.
All right, is the procedure easy to do?
It's very easy to do. It's literally just a needle, like an injectable, like a Botox or filler. It's very simple, and there's really no recovery or no downtime. I
love that there is another option out there for those millions of Americans suffering that is showing a lot of promise. Dr. Thompson knows all about this. For any questions, everybody, go to goodforutah.com/extra. Thank you.